my name is Dr. Cesareo. My job is to be a doctor. I'm a surgeon and an endoscopic surgeon also. My main job during the whole day is my scheduled surgeries, abdominal surgeries, most of them, like gallbladder removal, like appendix removal, like trauma surgery, like people with gunshot wounds, accidents, and my second MD it's endoscopic, gastrointestinal endoscopy. So I used to do some endoscopic procedures through the mouth, through the rectum, to take a look at the large bowel, as well as the stomach, to diagnose active bleedings, ulcers, and try to resolve those issues on my patients. My job, like, you can understand that it's very time consuming, it's very demanding, and sometimes I need to work between 60 to 70 hours a week. While talking about just med school and then get the two MDs that I have, I invest around that time around 12 years in order to finish all my training, my medical training. That includes med school, then internship, the first MD on general surgery, and then the second MD on gastrointestinal endoscopy. At this moment, I have around 25 years experience after I finish my medical preparation. I work in two different places. First, I work in a government hospital, so I'm in touch with all kind of peoples, from the most poor people to the most wealthy people when I'm on my private practice at my office. So I've been blessed to working with all kinds of people and to help all those kind of people to feel better. And I have tons of colleagues from different MDs, different specialties, that we work together at the hospital. So I'm in touch with several different MDs, different specialties there, like cardiologists, pneumonologists, nephrologists, etc., etc. I love this kind of job because it's a totally different job from all the others that one time I think to study, because you're in touch with a lot of different people. That's the first thing. And the second is that every procedure that I have to make, every surgery that I perform, every endoscopy that I do, even that you can think that it's the same procedure, but it's not, because every patient it's different. So every time I do a surgical procedure, every time I can expect different things, different resolutions, different changes on the anatomy of the patients. So it's kind of fun. I work like this, where you're gonna have every day or every other day different things, so you don't get bored at any time. What I enjoy most of my job is to be in touch with people, and the most enjoyable thing of that is to feel that you can help them feel better. There is no better feeling that seeing the people get recovered from different diseases. That's very very great. That's what I love most about my professional. Okay. You have, for a start, you have to study a lot. That's for sure, and keep studying every day. Like in most of the specialties that you, most of the jobs that you can work. Always you need to be up to date. You have to keep studying every day, and obviously in medicine that increase a lot more. So you have to keep every day studying. I study every day for at least half an hour, different and new things. So that's the first thing. You have to keep pacing of everything new. One. Second, you have to be very humanitarian. You have to be calm, think fast. Sometimes you need to think very fast, mainly when you're in surgical trauma procedures, that you need to make the best and good decisions very fast, trying to recover your patient. So I would say be prepared every day, be calm, and be very wise. And maybe the best thing that you have to be or to have in this profession is to recognize where is your limit, and when to call for help of another of your colleagues, when sometimes you feel that that patient needs a little bit more help with another specialist, and ask for that help. Well, in this case, every patient, it's a challenge in different ways. But I think the most challenging procedures are the emergency procedures. And from the emergency procedures, the most challenging are the trauma surgery patients, because you need to be acute, to think fast, and to work fast in order to save the life of that patient. So I will say trauma surgery patients. There's a lot of different people. There's a lot of different thinking. So there's a lot of different patients, and you need to treat all of them according to their culture, according to their health, according to their way of living. You're not going to explain the same to a person that doesn't have any school preparation. You're going to talk to him and explain to him different than you're going to explain to a NASA scientist. You're going to have to explain to explain him different. But my relationship with all of them, it's I think very good. You just need to get or try to get to the level that they have, or the level that you think that they have, and explain them as well as you can. Well, the main assignments that you have to take and be good at, it's biology, mathematics, because we manage a lot of statistic things. We do a lot of procedures and have to keep track of them, so you need a lot of statistic things. Biology, physics, and lab chemistry. Well, there's ton of people that work at the hospital. Besides doctors, there's a lot of people that keep rolling the hospital, mainly nurses, lab people, even the people who cleans the hospital, what else? Technicians, maintenance people, engineers, biomedical engineers, but kitchen people, they make all the food for us and for the patients. So there's a ton of different people and specialties that work at the hospital and keep rolling the hospital.
Thank you for take your time for be with us and explain us how your work is.
My pleasure. Thanks to you.